anxious to get the country's economy back up and running again as soon as possible, President Donald Trump is facing mounting pressure from health and economic experts across the country who are telling him that he needs to implement a far more robust COVID-19 testing and contact tracing program than what is presently available if he hopes to reopen the economy safely without risking a resurgent outbreak of the novel coronavirus. In response, President Trump made a Rose Garden announcement late Monday afternoon for the federal government to ramp up testing by assisting the states.
I know that there are some governors that aren't necessarily ready to open up their states, but they may be ready to open up their school systems. We'll see.
But his blueprint for opening up America again, as the White House brands it, still falls far short of what most public health officials say is actually needed. Currently, the United States has tested about 5 million people in total, whereas most health experts agree that we should be testing about that many every week. Many argue far more, say 1 million tests a day. This weekend, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told the National Academy of Sciences annual meeting that the U.S. does about 1.5 million to 2 million tests a week and said that we probably should get up to twice that as we get into the next several weeks. And I think we will, he said. He added that we need to, quote, get those who are infected out of society so they don't infect others. During the Rose Garden announcement for, quote, opening up America again, I asked President Trump.
Thank you, Mr. President. Dr. Anthony Fauci says that we need to increase testing by double it at least, and so does the Rockefeller Foundation. When are we going to be doubling testing?
It doesn't really matter what they say there, and we just left him. We just had a meeting, but because we're going to have much more than double it very soon. Now, there are big believers in testing, and then there are some governors that don't feel as strongly about it at all. You understand that. They feel much differently about it. But we're going with maximum testing because it's something we're very capable of doing. But we'll be much more than doubled.
The president then handed the question off to Vice President Mike Pence.
I hope the American people looking on today are as proud as the president and I are of the incredible public and private partnership that you heard from today. It was 2 months ago that we had done less than 10,000 tests for the coronavirus in the United States. But because the president brought together these incredible commercial labs, brought together the best-known retailers in America, now, Mr. President, we have 5.4 million tests.
Vice President Pence then handed the lectern to Admiral Brett Giroir.
Thank you, Mr. President, Mr. Vice President. The number of tests that need to be done depends on the state level. You understand that places where there's high virus circulating will need many, many more tests. Places that do not have high virus circulating may need less tests. But let's just assume Dr. Fauci was talking about a 4 million per month number, which was sort of a week ago where we are.
I think he said 4 million a week.
So we will, according to the governor's plans for next month, we will easily double that 4 million number.
Dr. Fauci had actually recommended 4 times that number. The president's announcement comes as the U.S. death toll passed 55,000, while confirmed cases neared 1 million. Meanwhile, there is no cohesive national testing plan. With only 4% of the world's population, the United States holds the unenviable record of fully 31% of worldwide deaths from coronavirus. Doug Christian, The White House.
Why did Maryland have to go to South Korea to get 500,000 tests?